I'm Dr. Sinan Gocmen, chiropractor and regenerative medicine specialist in Davenport, Iowa, serving the Quad Cities, Eastern Iowa, and Western Illinois. What if I told you that up to 90% of the stem cells you paid $12,000 for never ever made it to the damaged tissue you were trying to heal? I've worked with hundreds of patients who came to me after spending tens of thousands of dollars on regenerative therapies that did absolutely nothing. And today, I'm going to show you exactly why. If you want to know whether you're a candidate for a protocol that actually works, the link to apply is in the description, whether you're local to the Quad Cities or watching from anywhere in the country. Point number 1. Most stem cells get trapped in your lungs before they ever reach the injury. Standard mesenchymal stem cells, MSCs, are typically 15 to 30 micrometers in diameter. Your lung capillaries are only about 7 to 10 micrometers in diameter. According to research published in the Journal of Translational Medicine, an estimated 80 to 90% of standard MSCs become trapped in the pulmonary capillary bed when delivered intravenously. The lungs act as a biological filter, and most stem cells never make it past that first pass barrier. It's like trying to push a basketball through a garden hose. The cells get stuck in the lungs. They never reach the peripheral nerves in your feet. They never reach the inflamed joints in your knee. They never reach the damaged tissue in your lower back. Now, if you're dealing with neuropathy, numbness, burning, tingling in your feet and hands, those damaged nerves are in the periphery. They're the farthest point away from your lungs. So even if a small percentage of cells make it through, they still have to travel through your entire circulatory system. And by then, most of them are already dead or inactive. MUSE cells are fundamentally different. They're only 8 to 15 micrometers in size, small enough to pass through the pulmonary capillaries and circulate systemically, reach peripheral tissue, cross into inflamed joints, and even navigate through the blood-brain barrier in certain conditions. Now, standard MSCs are like a repair crew driving a semi-truck to a disaster zone. MUSE cells are like a special forces unit arriving in ATVs. One gets stuck at the gate, the other gets through. But even if the cells make it through the lungs, there's a second problem. They need to find the injury. Point number 2. Your body is screaming for help, but most stem cells don't have the GPS to find it. When tissue is damaged, it releases chemical signals. One of the most important is called SDF1, stromal cell-derived factor 1. Think of it like a distress beacon. We need repair cells here, now. Dr. Mari Dezawa's research at Tohoku University demonstrated that MUSE cells express high levels of CXCR4 receptors, which respond to that SDF1 signal. This is called homing behavior. Standard MSCs have limited or inconsistent expression of these homing receptors. They don't have a GPS. They circulate, they drift. Maybe some of them happen to end up near the injury by accident, but there's no active targeting. It's passive distribution, not precise delivery. Imagine calling, 911, but the ambulance doesn't have your address. They're driving around the city hoping to find and stumble upon your emergency. That's what passive circulation looks like. MUSE cells have the address. They know where to go, and here's why this matters for complex conditions. Neuropathy involves nerve tissue, vascular dysfunction, and inflammation across multiple systems. Autoimmune conditions might involve gut lining, joint cartilage, and neural signaling all at once. If your stem cells can't detect where the damage is, they can't get there. And if they can't get there, they can't signal repair. Even if the cells reach the injury site, there's a third problem. The environment itself will kill them. Point number 3. Even if the cells reach the injury, most of them die before they can do anything. Damaged tissue isn't a friendly environment. It's inflamed, hypoxic, meaning low oxygen, and full of free radicals and inflammatory cytokines that destroy cells. Standard MSCs are like troops trained for peacetime. When they land in that hostile environment, most of them die fast. Research in stem cells, translational medicine, shows that MUSE cells express stress tolerance proteins, including serpin protease inhibitors and 14-3-3 anti-apoptotic signaling molecules. Say that 3 times fast. These proteins protect the cells from programmed cell death, apoptosis, even in hostile inflammatory environments. In plain English, MUSE cells are built to survive in hostile environments. They can withstand inflammation, low oxygen, and oxidative stress long enough to actually do their job. When we deploy MUSE cells into chronically inflamed environments, well, they survive long enough to signal repair. They don't just show up and die. They engage with the damaged Schwann cells, the compromised blood vessels, the inflamed nerve tissue. Think of it like sending firefighters into a burning building wearing protective equipment. They survive long enough to actually fight the fire. Now, if you're watching this and thinking, well, I've tried stem cells before and they didn't work, is this actually different? That's a fair question. This isn't about one therapy being a miracle. It's about understanding that the biology of the cell determines the outcome. If you want a more detailed breakdown of how we actually use this in clinical practice, well, I've put together a free training for you. Whether you live here in the Quad Cities and want to come to the office, or you're further away and want to meet virtually via Zoom, the link is in the description. No pressure, no hype, just clear education so you can make the best decision for your health. Point number 4. Your body has 3 major tissue systems. Most stem cells therapies only talk to 1. During embryonic development, your body forms from 3 tissue layers. There's the ectoderm, your nervous system, skin, brain, mesoderm, muscles, bones, blood vessels, and the endoderm, gut lining, organs, internal systems. Standard MSCs are mesodermal stem cells. They primarily signal to mesodermal tissues like muscles, bones, joint, and blood vessels. But if you're dealing with neuropathy, which is a nervous system damage, or autoimmune gut issues, which involve endodermal tissue, standard MSCs are operating with incomplete signaling. Now, Dr. Mari Dezawa's foundational research demonstrated that MUSE cells possess trilineage differentiation potential, meaning that they can theoretically differentiate into cell types of all 3 embryonic germ layers, signal to nerve tissue, to muscle and vascular tissue, and to gut lining and internal organs. Peripheral neuropathy involves nerve damage, ectodermal tissue, but it also involves poor circulation and damaged blood vessels, mesodermal tissue. And in many cases, especially diabetic neuropathy, there's a gut inflammation and metabolic dysfunction going on. Endodermal tissue. So if you're only signaling to 1 tissue layer, well, you're addressing 1/3 of the problem. Point number 5. The industry doesn't want you asking these questions. When you go to most regenerative medicine clinics, they'll just say stem cells. They don't tell you whether it's bone marrow derived, adipose derived, umbilical cord, Wharton's jelly, or MUSE. They don't tell you cell size. They don't tell you whether the cells express CXCR4 receptors or stress tolerance proteins. They just say $12,000, you'll feel better. A 2019 review in Frontiers in Bioengineering and Biotechnology noted that the term mesenchymal stem cell is used inconsistently across clinical practice with significant variability in cell source, processing methods, viability, and functional capacity. Without standardized definitions, patient outcomes remain unpredictable. And here's what you deserve to know before you spend another dollar on regenerative medicine. What type of cells are you getting? What size are they? Can they reach peripheral tissue? Do they have homing mechanisms? Can they survive in an inflamed hypoxic environment? What tissue layers can they signal to? If your provider can't answer those questions, you're not getting informed consent. You're getting a sales pitch. The truth is, regenerative medicine works, but only when the biology of the cell matches the biology of the injury. At Abundant Health Physical Medicine here in Davenport, those are the questions we answer before we start. For local patients and for those we see via virtually Zoom or from anywhere in the country, the link to apply for a discovery session is in the description. Standard MSCs are too big and get trapped in the lungs. MUSE cells are small enough to circulate systemically. MUSE cells actively migrate toward damaged tissue using CXCR4 receptors. Standard MSCs drift passively. MUSE cells have stress tolerance proteins that let them survive inflamed environments where standard MSCs die. MUSE cells can communicate across all 3 germ layers. Standard MSCs are limited to mesodermal tissue, and the industry treats all cells the same, but they're not. That's why outcomes vary so wildly. In my next video, I'm going to break down exactly why gabapentin, cortisone injections, and standard protocols fail to reverse nerve damage. If you're in the Quad Cities, click below to book a consultation at my office. If you're further away, watch the training in the description. The next step starts with you.